Today's topic is men's mental health, specifically gay men and their mental health. My guest is Matteo Stewart. He is a 3-time international TEDx speaker, a belonging practitioner, and a senior inclusive leadership facilitator, just among a few things. There is so much to unpack in this topic, and it starts at the intersection of mental health and identity. Beam Credit Union is proud to sponsor today's episode. With deep roots in BC and a commitment to your financial journey, Beam believes wellness, mental and financial, starts with support you can count on. Matteo, I am so grateful for you being here. Thank you so much and taking part in this big topic that we're talking about today. You and I sent a few emails back and forth about this, and just to make sure that we had the right focus. And we talked a lot about identity, and you said something very specific about identity, and I'm going to read it because I'm going to quote you.
Okay.
And that's where I want to start. So in relation to identity, you wrote, the different experiences that gay men who are open with their identity versus men who have sex with men but do not openly identify as gay. And that sentence, I was like, yes. So I need you to speak a bit more about that.
For sure. Yeah. And thank you so much for this opportunity, even just to have a conversation, because I'll be very honest. I can't speak from any other lived experience. And when you think about the queer community, the 2S LGBTQI plus community, I know that's a mouthful. We're really not a community. We're communities. Right. And there's so many different intersecting identities. And
which is that mouthful of an acronym.
Right.
But it's all important in your own right.
Yeah. But I identify as a gay male and I'm getting a bit older now. I've got some gray in my beard. That said, I have been out since the early 90s, meaning that I've been out to myself. I've been out to my friends and family. I've been out in my career. And from my understanding, you know, when we think about the communities or you think about gay men, especially around health, so many of individuals who might have a different sexual orientation, whether they are open and share that with others or not, is irrelevant when it comes to the end of the day, that we're still human beings who experience health challenges, and mental health is important. And the experience that I might have as an openly gay 50-year-old here in the Okanagan, very different than somebody who is closeted. And often those folks are not the ones that get studied academically, are not the ones that get the traditional support, and often get excluded from the support that they probably do need. And that's where my heart breaks. And it really wasn't until, and I don't want to, but we have all this plethora now of online apps, right? Where people who are looking for, sex with men can find that. But these are individuals who will not post their picture. These are individuals who will not be out to their wives or to their girlfriends or to the community. And it breaks to hear that these are individuals that, like all of us, are suffering from a variety of different conditions, whether that's mental or physical health, and yet they don't have the same access. Where for me, I think probably because of my, white male privilege of being out, I can go to my doctor and just be like, no, I'm a gay man. And immediately then we can have a conversation about my health. I've also been diagnosed with leukemia, as well as a tumor that they found in my shoulder. But I can have a very open conversation about my health, about my sexual health, with my healthcare providers, with my health team. But what about, and this is what's really, and it's really only within the past couple of months that this has come to heart for me, is what about those individuals that can't be open because they're not open to themselves or others? How do they access the same healthcare?
And when you talk about healthcare, what's enfolded and embedded in that is mental health care. Because mental health is health. Okay, so I've been scribbling notes because we basically covered the whole podcast right there, which is great and gives us lots to work off. One of the first things I want to talk about is the first thing you said is out to yourself. Yeah. And as a straight cisgender female, that line, out to yourself. Because, and that really talks about identity, because certainly we talk about community and out in the public, a very important part, but out to yourself. Yeah. So what does that What does that mean? What did that mean for you?
For me, well, it was different. Back in the 90s, I came out in the 90s, so things were different than they maybe are today. That said, maybe things are changing, right? With the political landscape changing as well. But for me, that meant that I had the fear of could have been kicked out of the house. I had the fear of, if I left, where would I go? Who would support me? I didn't have friends, that were openly gay when I was 17 or 18. I didn't have that network of support that I have now. So for me, I have a network of support. So when I'm saying I'm having a bad day, I've got a husband, I've got friends and family, I've got folks that can be there for me. And that's where I think that because I'm out to myself, I can be truthful and honest about my lived experiences.
So is not being out in public the same as not being out to yourself?
Well, it's interesting because I love that intersection. And I wonder, and again, I can't speak because I have been out, but I know when I was closeted, the impact that had on me, on my mental health. Yeah. And if it's okay, I'm going to share a story because this hit me just today. I just got from the gym just before coming here. And this has been something I've been going to the gym as part of my health journey with my cancer treatment. But at the gym, I've been now accepted by the gym bros, right? All these straight identifying, I don't know, they haven't disclosed but they're very straight identifying, straight acting, if you will. And what I found is the moment they started bringing me into their little group and having conversations, I started lowering my voice. I was code switching, and it wasn't something I was thinking at, prefrontal cortex, me thinking about I need to change who I am and adapt. That was part of my resilience. That was part of my adaptive strategies in order to survive. And
even though you were already...
I've been out since the 90s.
And for intents and purposes of this conversation, in this example, you were accepted by these folks at the gym already. You didn't start with code switching. The code switching came after acceptance.
Yeah. And so if I'm code switching, what about others who, because of, the rhetoric, the political rhetoric out there, I wonder what impact that's having on them and on their mental health.
Yeah. That's my next question, that erosion, that day in, day out erosion to yourself. So in those quiet moments when you're with friends or family, or when you're doing something that many people do, work out or be active in a number of ways, and that's that identity piece that we talked about. So you're not being true to who you are, and that takes a toll on your mental health.
It does. Yeah. But then so does, for me, and I'll be, looking at what's happening to our neighbors in the South, the erosion of, rights for the LGBTQI plus community, even rhetoric here in Kelowna with local politicians who will advocate for or introduce bills to pull back the rights and freedoms. And we have, a neighboring province that is removing rights or looking to use a notwithstanding clause, and the impact that has on folks. And it's interesting because I've been spending some time with, because I'm now 50, with a group of 50 plus gay men. We meet every Saturday for coffee. We have different events. We have tea dances, and it's great. But these are individuals that they came out before I was even born, some of them. And to hear their experiences of what it was like back when to be gay was criminalized. There wasn't the same legal protections. They lived through the AIDS crisis where they lost so many folks. They don't have that same family experiences. So yes, they're very resilient, which is awesome. But are they thriving? And it's interesting now when I look at that. Now when I look at how they are adapting, many of them, some of them, where they've been with their partners for 40 plus years, now their partner passes away. And how do they access care services? Or we have one individual who's now gone into a care home who had been out since 1974, but now in 2025 has to go back into the closet in order to survive in a nursing home.
Right. An individual may have thought that they were out, they had community, they had their support network, and that falls apart for whatever reason. Yeah. And it's almost like starting over. And what you're saying is a fundamentally different era, no matter how you look at it. I mean, socioeconomic, political climate notwithstanding, just the fact that we're talking, 90s or 70s versus 2025. there is a huge discrepancy
Yeah.
in what society
It's
is like.
so true. And it's interesting because what I'm also discovering, and this was true for myself, is that many gay men, when we came out, that was trauma. And we don't necessarily talk about the intersection of trauma and the gay community, but there's a lot, for many of us, a lot of trauma. And even though I might think, oh, I'm fine, I've been out at work, I've been out, as soon as I hear about, some legislation being passed or a bill being introduced, that brings back new trauma. And I get re-traumatized.
So how do you manage?
And that's just it.
After all these years,
I'm still struggling with that on a personal level. When I heard an anti-gay slur at the gym, which I thought, oh, here I am but that's, part of the, people say locker room talk. That's still traumatizing.
Mm-hmm.
And where this really came to head for me, and I'm going to share the story if that's okay.
Mm-hmm.
A few years ago, I was up for election to join BC Hockey's board of directors. And to me, it was awesome. I played hockey. My grandfather played for Detroit back in the 30s and 40s. And so for me, hockey's been a big part of my family, right? We grew up with hockey. And I really wanted, and I was part of the 2010 Winter Olympics in Vancouver, where hockey, that was one of the biggest highlights for me. Biggest highlight of my career was to be able to say that I worked on the Olympics at the hockey venue, when we won gold for the women and the men's. That said, when I was up for election, I was really excited about, and I'd worked on several other boards over the years. But when I went, and it was down in Penticton at one of the convention centers, and I walked into the convention center, I thought I was fine, and I had a bit of a panic attack. And I was I literally had to take myself out of the room, went for a walk along the lake, going, why am I at my age having this panic attack now? And I realized it was bringing up trauma from back in the 80s when I was gay bashed in the hockey, at the arena, in the locker room. Now maybe if I'm impacted like that and I'm supposed to be the strong, well-adjusted, what about others that aren't? What are we doing to help support them? So it's not just about resilience, but the ability for us as human beings, because at the end of the day, whether we identify as gay or not, we're still a human being. How do we set the conditions for us to be able to thrive and not just survive?
And part of one of those conditions that you mentioned earlier was that sense of community.
Yeah.
And what's interesting to me is in your storytelling there, and thank you for sharing these stories. I guess when I was thinking about community for this, I was thinking of the community in this particular instance would be gay men. But it seems to me like you just talked about, you have a community at the gym of straight acting, straight identifying individuals, men included. So is there a distinction between those two senses of community?
I think there is. To be honest, for me, one of the things I love is, now that I've joined this 50 plus gay men's meetup group, is we can just be ourselves. And it's not that we are gay. It just so happens that we're surrounded by other gay men of similar age, similar lived experiences, but we can just be ourselves. And we don't have to be labeled, or, the label is there, when we have a tea dance, or we're just meeting up for coffee, or we're going out for a beer, but we're just us, right? It's just us. And it's just a group of people with, again, some similar interests, some similar backgrounds. And we can talk about the Blue Jays, or we can talk about hockey, or we can talk about, taking care of our garden and getting it winterized, or and our identity isn't the identity is why we're there, but it's not the driving force of the conversation. It's not and so we're building this community. And so some of us go to the gym and we work out and we share workout tips. Others don't even go anywhere near the gym, and that's okay. But we're still together. And for me, it's a very different, I can be myself, and my guard is now down. I don't have to think about code switching. I don't have to worry about anything. And that, to me, that is probably the ultimate level of psychological safety.
Right.
There.
Is that thriving?
For me, that would be thriving.
Right.
Versus I have to be in survival mode, or I have to, whether I'm cognizant that I'm in survival mode or not, I know my body reacts differently. So when we talk about mental, they're interchangeable. They're not two separate things. They're interchangeable. I know when I am thriving, my cortisol levels are lower. And it's interesting, because of my cancer, I am going constantly for blood work. And what's interesting is when I can see when I am thriving, or now that I'm part of this community, my inflammation markers are lower. I'm seeing, my blood work is coming back much more positive. But when I have stress at work, when I have stress in the community, when I have stress outside, and I don't feel like I have that sense of community, I see my blood work change.
That's
And it's
incredible.
it's interesting to see that. Right?
Yeah.
And so now I wonder but not everyone has access to
No.
get their blood work done
Yeah.
every 2 weeks.
Yeah.
So how do we support those folks that you don't even know how to ask, right? For me, I guess I'm problem aware and solution aware, but so many folks in the gay community, especially for gay men, aren't necessarily problem aware and not necessarily even solution aware. How do we help them?
Right. Well, and that's part of why we do this podcast is sharing stories like yourself and talking about things that work for you anecdotally on a day-to-day basis. We're going to go over some resources and things that have worked, but just also trying to build that sense of community that, this gay male, older gay male, 50 plus gay male community, that's important. You said we can be ourselves. And I had a question here about societal expectations of men and societal expectations of straight and gay men and how that plays into it. I mean, you talked about, not to keep bringing it up, you talked about this code switching. That's also I see that as a societal expectation of what a man, full stop, like just man's voice is deeper and his sounds a little like this because this is what you're supposed to do. How does that impact your discussions around mental health?
Oh, huge, because again, I'm not allowed to cry. I'm not allowed to show emotion, right? When I say not allowed, that's in my head, right? Why is that in my head? Because of, again, societal expectations, right? When I think about when I'm having a hard day at work, who do I get to vent to? Right? Am I allowed to vent? Am I allowed to even talk about it? And that's in my head, but that's where I go, where my expectation is that I can't share that struggle. And what I hear as now part of this this group of older gay men who've come together, we've shared that we have the same concerns of body image, the same concerns now of, do I fit in? Right? My body is no longer the same as it was back in 1997 when I was at the clubs and I was all that. But now
aren't we all in that
body
position?
Changing, but now also, where do I find a sense of community? Right? Where do I go to feel like I can just be myself, or I can be who I am? And the other thing too, which is really interesting, is this notion of when you have a partner, like I've been together, I don't want to say how many years we've been together. We've been married for 14 years, probably together for closer to 20. But if I were to, let's say the cancer were to take me, my worry, and this is something that my partner shared, is then what? Then what do we do? It's not like we go back on the market and we can just, easily pick up. It becomes harder, right? To be able to find, that sense of community. And to be able to talk about things like loss, and loss not just in terms of a death, but loss in terms of one's identity. Right? For me, a big part of my identity is the work that I do. But now, as I enter to the age of retirement, it's like, what is my identity? What becomes my purpose? And I think that's sort of an intersection too. Is for when you're talking about mental health, is what purpose do we have? Because we know when we look at the data, when people have a purpose, they thrive, right? Their health improves, both mental and physical, right? And so how do we find that purpose beyond just, whatever our identity is? And for me, I look at, when my career was over, what's my identity? Am I always just a gay man? Or am I a gay man who also plays hockey? A gay man who also, gardens, or what else I do, right? And so there's that component as well. And then for many of us, for me, I'm lucky I have a strong family, but so many gay men, especially gay men older than me, are estranged from their family, or their families passed on. So who do they have to go to when they're having a bad day? When they need to get picked up from, the hospital because they've just went, like the other day, went through radiation treatment. Who's picking me up to drive me home after that, right? I have that a community that folks that can come together, but so many people don't.
Are there expectations in your experience, within the gay male community? Are the expectations about talking about mental health different
100%.
than in the straight male community?
Yeah. And I can't speak for all gay men.
Of course not.
But for many of us, it's either you're out and you're strong, or you're one of those weak, closeted people. And it's an interesting divide that I don't think it's talked a lot about.
You're weak because you're not out.
You're not out. Yeah. You're not out. You're closeted. And those folks tend to get pushed aside in the community. We don't offer the same, empathy or support.
But it's interesting. The other part of that is you said out and strong.
Yeah.
But that implies,
we're not.
Well, yeah,
that's just it. We're not. And I'll be the first to admit, I will seriously, when they found a tumor in my eye, immediately wanted to cry. But in front of my partner, in front of my friends, I put on the strong face. I didn't cry until I was alone in the bathroom. Right. And that expectation, right, to not be able to address one's feelings or to suppress and be, I think another thing too, that's maybe a skill that, gay and lesbian people have, is we've done, for many of us, for so many years, have been able to either repress our feelings or compartmentalize it so that we can survive. And we're in survival mode all the time.
But we also know, you were talking about what's good for our bodies. We know that is also, that's not good.
Because now you're operating where your amygdala is being triggered, or you're storing unhealthy emotions in the body, which are impacting the rest of the whole health system.
Did you have, you talked about specific incidences, and certainly being diagnosed with leukemia is huge. Throughout your life, instances of struggling to manage your mental health, and how did you
easily
balance this juggling act?
Here's the thing. And I was going to drop it enough, is the only way that I've really gotten over it is to be like, I'm going to struggle and still show up. And for me, that's been my strategy. Now that works for me. That doesn't work for others. Right. And so some people go, well, aren't you nervous? And I'm like, yeah, I'm nervous. I'm scared. I'm sweating like buckets, but I'm going to do it anyway. And that's not always a healthy approach, because I'm not addressing, but it's not necessarily the most effective way of doing it. But that's what has worked for me, because that's what I had to do as an 18-year-old who's coming to terms with, I wasn't interested in my girlfriend. I was interested in her brother. And now what does that mean, right? And how do I put that feeling aside, and the hurt that came from the homophobia, from the comments that would be left on my yearbook, or the comments that we made in the hallway at high school, or the comments that we made by the principal or the teachers that were anti-gay. And I just survived. I went into survival mode to be able to push that aside.
Right. And so if someone who's listening right now in survival mode, and you said, I'm going to struggle, but I'm still going to show up. I feel like what I'm hearing is they got to find their way around what that looks like.
It could be, but is that going to work for everybody? No.
Yeah.
And I'll be honest, at 50 years old, that has not been the healthiest. Because guess what that meant? That meant that I, on a Friday night, would be smashing a pizza and a large bag of ketchup or salt and vinegar chips, and I went to food as my solace. And I was very large. At one point, I was over 300 pounds, and that wasn't a healthy way to deal with it. But that's what I did.
And sometimes, when we talk about managing mental health, it's the grief or the struggle, being in the moment, noting, acknowledging, but not sitting in that for too long. Yeah. And so that sounds like, you kind of oscillate and float in and out of that. Yeah. We talked about, and you mentioned accessing health. So whether it's mental health, but in this instance, let's talk about physical health care services across the community as a gay man. This is another aspect of that didn't occur to me, because there's also gay men's sexual health.
Yeah.
There is a thing, and there's actually a resource that we'll mention later on that's for that. But then just also accessing health services, and the act of sharing with your the medical practitioner that you're gay.
Yeah. Well, and it's such a critical thing, right? And so if I just take a step back, because there's two parts. So 10 years ago, when I was first diagnosed, it took months for the team to figure out what was wrong. Leukemia can be sometimes difficult to diagnose, but because I shared that I was gay, the initial doctors, because then I didn't have a family doctor, I only had, I'd go to the drop-in clinic and be like, hey, I have night sweats, I am not feeling good. And, I mentioned that I was gay. And so what did they do? They did HIV tests. They did hepatitis tests. And they kept saying, but you don't have HIV. You don't have hepatitis. You don't have any sexually transmitted disease. And because they were limiting the testing that they did, because the assumption was because I was a gay man, it must have been HIV, or it must have been a sexually transmitted disease. Not that it could be a disease that affects any human being.
Yeah.
And it wasn't until mind you, I was an advocate for myself, and I was strongly advocating that no, something's not right here, that we finally did some additional tests. But that was months. It was almost like 7 months before I got, and that to me was, if I hadn't been that advocate, how long would it have been before I started getting treatment?
Well, advocating, hey, we've talked about on this podcast a lot, advocating for your health and mental health. I mean, it's a tough system out there right now. Doctors and nurses and everyone that had in the medical system, they're working hard, but our system needs an overhaul.
Oh yeah.
And so oftentimes as an individual, advocating for your health is kind of how we have to roll these days. That has been my experience and the experience of many people that I talk to. I didn't think about that, about the opposite. Yeah. So I was thinking about not being out to the doctor.
Oh, yeah.
You're talking about being out.
I'm out.
And them making
and they go the opposite direction.
Bias.
But here's the thing, too, that often doesn't get discussed, especially, and again, this is the intersection of mental health and physical health, because they're so interconnected, is for many people in the gay community, there are resources like medications like PrEP that could really help prevent, not just get exposed to HIV or AIDS, but to also be, some preventative medicine. However, here in the Okanagan, if you're in Vancouver, you're in Toronto, you're in Calgary, access to medication like PrEP is very easy to get. You go have a conversation with your doctor, you can get prescribed on it, and you can go. Here in the Okanagan, not every doctor will do that. And then if you want, guess where it comes from? It has to be shipped from Vancouver. And not every pharmacy will fill that prescription here because of, folks' views on what they would say enabling the gay lifestyle, if you will. So it becomes much harder. And then, so if you have a physician that you're not out to, or you have a physician that you do come out to, it's so hard to get a family doctor. How do you then get on PrEP? Or how do you get access to this, which can be, what the data tells us, in terms of very beneficial for, of course, there's all things like safe sex practices, which are still 100%. Very important.
Yeah.
But still, the fact that we have a potential very effective, the data is very clear, potentially very effective solution, or at least part of a solution, and yet gay men can't access that equitably here in the Okanagan as compared to other communities in Canada.
So that I am clear.
Yeah.
You're talking about a widely medically accepted medication.
Correct.
It's not, it's legal. It's, proven and widely practiced in many medical facilities in terms of writing these prescriptions.
Yeah.
Okay. And you're saying that not only is it not accessible here in Kelowna, you would have to get it from Vancouver, but some doctors and some pharmacies just will refuse.
Yeah. So there, in fact, one of the groups that I was going to mention, like Kim and Advocacy Canada, will tell you, here's the doctors that we recommend, here's the pharmacies that will fill, and that list, when you look at the overall list of pharmacies in the Okanagan, it's quite small. Mind you, there are now online options which you can go to, but then I always wonder, if you're going to an online option, you're not having the same conversation with an online doctor as you would with your primary care physician.
Right.
Right. And so that's where now I worry about, that intersection of, does your primary care physician or your care team fully know and understand your entire lived experience and your entire lived history? Because then now, when you start talking about, well, I'm having mental health issues, or I might be on other medication, so many folks, because it's not, if I was to be admitted to Interior Health, they would have access to the medications that have been prescribed to me. But if I had to get prep
Right.
outside,
Mm-hmm.
guess what? That's not going to show up when
Right.
they go to emerge, and I'm unresponsive. And if I can't tell them that I'm on prep, they wouldn't have access to that because that's not being administered through that system.
Right.
And so we run that risk as well, right? Of not, that medical team, your care team, not having an understanding that gay man's full, care that they're receiving.
Right. Yeah, that holistic care,
Yeah.
right? Everything that an individual needs that perhaps individuals like myself wouldn't think about that.
Right. Yeah.
Right. I wouldn't think about, it wouldn't occur to me that a pharmacy would not, are they allowed to do that? Not fill a prescription.
It's unfortunately, yeah. Yeah.
Yeah. Gosh, we've got
Yeah.
so
Sorry,
many
yeah.
things
So
to
much
talk
to unpack,
about.
yeah.
So much to talk about. I want to how like let's just briefly before we wrap up. You have a cancer diagnosis, and so really talking about that mind-body connection.
Right.
How are you managing to keep yourself healthy
Ooh.
physically and mentally?
So what I'm finding is I'm lifting things. So what I love, when great folks at Interior Health, great folks that are there, my care team's amazing. But when I leave, I'm on my own, right? Like I drive myself home, and now how I'm managing is I'm really hyper focused on what I eat, right? So now, cutting down sugar, so I'm focused. I've got that laser focus, if you will. But now I'm moving things. So at the gym, my favorite thing is the sled push and pull. So my trainer's got me, just lifting heavy things. And what I'm finding is when I do that, I've got the headset on, I'm in a zone, as the blood's going, as I'm doing, to me, I'm finding great solace in that. But then the best solace has been after I'm done, the conversations that I have, right? The guys there at the gym, they go, "Yo, Gym Santa, how you?" I've got this nickname, and the lady who works behind the smoothie bar, she's always like, "Are you gonna get your usual today?" Right? And there's just this camaraderie, right? And then tomorrow morning, wherever the people are watching, but tomorrow for me will be Saturday at 9:00. I'm gonna go meet a group. Sometimes we have 40 older gay men, and I'm usually the youngest one there, so I feel fabulous. But what I love is we just have conversation, and it's nothing to do with being gay. It's just us just having a coffee together, coming together, and watching folks they light up when they see you, right? And I light up when I see them. To me, that is something that I look forward to, right? And then we have a gay curling league, or it's a mixed league of gender non-specific, just individuals who identify as part of the community or supporters and allies. And I don't even curl, to be honest. I'm because of I have to be careful. So I sit upstairs with a couple of the other folks, and we cheer everybody on. And then everyone, once they're done, comes upstairs, and we just have this sense of community. And again, we're not talking about being gay. We're just talking about, but it's a safe space for us. I don't have to worry about somebody making some homophobic comment or a racist comment. We can just sit there, be ourselves, and not have to code switch or mask who we are. And to me, and we're genuinely excited to see each other. To me, there's no better feeling than that, right? It's the same when every time I go see my parents, right? See my mom, that big hug, and that kind of community, right? That where everybody gives you a hug, everyone's really excited, and when they ask you how are you doing, they ask, how are you doing, right?
Yeah.
And that, to me, having that, and so if we had that more available, or if we had folks where they had a sense of community and a sense of purpose, something to look forward to, would that help impact folks' mental health? It's not going to be the cure-all, but could that be? Because I'd rather do that than take another. I'm done with taking medication now. I'd rather focus on healthy eating, healthy living, and stuff that makes a positive impact.
Powerful words. Thank you. And so folks who are listening, and desperately want that. It's not that they don't believe it's not going to help them. They just don't know how to get started.
Yeah.
We talked about resources. You mentioned check him out or him.
Yeah.
It's checkhimout.ca, PFLAG Canada, GMSH, which is Gay Men's Sexual Health.ca. Yeah. What are some other ways that can support holistically and overall gay men that work for you?
One of the things I would recommend is get off the apps. Or you can be on them, but get out and meet, have a group of folks, have some folks to meet. So for anyone who might be interested, Advocacy Canada, which does a lot of great work to support the 2S LGBTQI+ communities, has some great events for the trans and supporting the trans community. We also have some really great meetups for gay men. We have coffee meetup. There's a bunch of tea dances that happen once a month. I love the tea dance because as I'm getting older, I don't want to go to the club anymore. The tea dance is great because it's like in the afternoon, I'm home by 6. Yes. And it's great. And it's over. And no, I'm not saying it's great, but it's just great because then I don't have to worry about going to the club. And then we do, like in the summer, we have barbecues where we just come together. And it's just a really great sense of community.
Right.
And our unifying factor is, yes, we might identify as part of the gay community, but that's only one part of our many intersecting identities. And we can just be our true authentic selves as whatever we're going to talk about, whether we're talking about football, or we're talking about hockey, or we're talking about gardening, it doesn't matter. We can just be ourselves and have that shine in our eyes. And that to me is probably the most powerful thing that's really gotten me through the darkest days.
Matteo, thank you so much.
Oh, thank you.
Big discussion. We went over a few resources there. At the end, we'll have the links to those on the Away Forward podcast page at cmhakelowna.org. If you have any questions or comments about this topic or any other topic, please feel free to email me at awayforward@cmhakelowna.org. Until then, please do take good care. This episode is supported by Beam Credit Union. With deep roots in BC and a commitment to your financial journey, Beam proudly backs mental health conversations that help build stronger, healthier communities.